for us as Māori, we have a lot invested in the concept of manaakitanga, which is largely about how we look after, how we feed people. More is always better kind of concept. And it's a beautiful whakaaro and a beautiful kaupapa. But we also have to now manage the fact that we can't continue to do that kind of manaakitanga with the kinds of foods that are available to us. But that then brings across the concept of why are we buying the $1.50 bottles of fizzy as opposed to the nearly $6 bottles of milk?
Does that come down to poverty?
Definitely. Poverty has got a large role to play in this. I mean, people are making choices every day to buy the $20 family pack from the takeaway store with the $1.50 bottle of fizzy, as opposed to a meal that might, and I know people go, but actually you can make a really wholesome meal for $15, but you've got to have the education and support systems around to help families deal with that. Not everybody has been brought up in a family where you get those, how to garden, how to buy the right things in the supermarket. No, not everybody has the time to go and do that kind of, that takes a lot. So there are so many measures that interface into why we have this growing rate of diabetes. And it's not because, people are lazy or people don't care enough or all the rest of it. It's got very little to do with that. It is chance and circumstance. It's about education. It's about the kind of public health measures we put in place.
Are you particularly concerned about what we're seeing as those end-stage complications when it comes to diabetes, those limb amputations, people on dialysis for 5 hours a day? Is that something you're concerned about, and how will the Māori Health Authority be working to change that?
So for those who already have developed type 2 diabetes, we have to deal with what is proper, what is good care, what is the kind of things that we're going to do to help prevent you getting to that next phase. For those who are already in the next phase, we have to make sure that you have better access and equity of access to those services when they're there. Okay. And we have to try and bring those a little closer to home. So in the next 2 years, we've got a whole range of things. So we want to see enrolment into primary care improve out of sight. We want to make sure that the screening and scanning services that we have, particularly for those who are either if we just focus on diabetes, pre-diabetic, or those who have diabetes, what is the quality of care they're receiving in terms of management of their care? Okay. That's just as an example with diabetes. And then some of the things will be about a range of activities to try and stop that tsunami from happening. So the population public health focus will be a huge focus for us at Te Aka Whaiora. Poverty will always drive poor health outcome. That's just a fact. If you cannot afford the things you need to live the kind of life that you need to lead, then that's going to be problematic. If you can't access services that are going to be, and again we speak into there shouldn't be a service that calls you out for being fat, right? There's no two ways around. We can't candy coat the fact that obesity will always drive toward not just diabetes but increase in cancer, your risk of cancer, I should say. And so there are some things where we need to drive out those kind of behaviours, but obesity is a response to often poverty.
But I suppose, how will you guys make change if it's a problem of poverty? What will you be doing? How will you even help that?
By working together across the sectors to make sure that we can actually implement things that are going to be really meaningful to turn that around. So, if you think about, I love the concept of housing, and not just housing as in everybody needs a house, but everybody needs a home. And the reason why that's important, a home that you own, is that it creates this sense of mana motuhake within a person, that actually I have a destination that says this is what it looks like. I have some control over these factors. Yeah. And as I build out those kind of self-controls and build on my health literacy and my education and a whole raft of other things, we start to make decisions that are different.
So will you guys be working with the Ministry of Housing and Urban Development?
Everybody. We already are. So we're already engaged in a number of programs, because what we realise is that we're not an island, and health can no longer be responsible for changing the outcomes that are actually driven by other social determinants.